one of the things that you have to know about prenatal care is that this is your opportunity to ask your questions. So come to your visit prepared. Have a list of questions that you want to ask, things that you're curious about, and things that you want your provider to talk about. Ask about what's going on in your pregnancy right now. What's to be expected? What's the baby doing? Discuss how you're feeling. You know, this pregnancy can be like a roller coaster of emotions. So you'll be happy some days and you'll be sad other days. And you'll often wonder, you know, what's going on. You'll be very sensitive. You'll snap at people. Your partner will say, "What's wrong with you?" So you have to realize that some of these emotional changes may be hormonal and others are really situational. So if things are going on, ask your provider to send you to the social worker or to help you with some of these issues, because not all of us have very simple lives. And when things are going on emotionally, or even, you know, financial problems or other problems with your partner, you know, there's data to show that sometimes there's more domestic violence with women who are pregnant, that if you feel that you're being abused or not treated properly, get help, talk to people, open up. You don't want to internalize all of this stuff. It's very important for you to share it. And again, going back to your support person, use that person as much as possible. This is a good time to lean on people. So bring in your worries to your visits. Find out what your delivery plan is, what to expect, what kind of things you want to use. If you want to have an epidural, you want that explained to you so that you can have some pain relief during your labor. Or if you prefer not to have an epidural, or some of the kind of things that you can do to relax, to help you to control the pain and things like that. And then ask for a tour, find out where you're going to deliver, and ask for a tour and what they have available for you and what the services are, and ask them if you could see the nursery and look around, because this is your pregnancy and you in control. This is yours. So the most important thing is that you are the most important person in this situation, and we all have to cater to you. And your providers have to be able to answer your questions and be concerned if there's anything going on and refer you appropriately. I have a question in the chat. So there's a chat comment. I've been asking about not wanting to get induced again if pressures are good and the baby's growth is on par. Perfect. You need to be listened to. You know, if your desire is not to be induced, your provider has to be able to address for you what's the safe thing to do. Now, the provider may feel that it's safe to induce you and deliver you early before you develop preeclampsia or any other complication. You know, there sometimes are complications with high blood pressure, especially if you have high blood pressure requiring medication. Your provider may feel that this is a condition that could lead to problems, you know, problems like separation of the placenta or increase in blood pressure, preeclampsia. So have that discussion, say why, and be listened to. One of the most important things in pregnancy is that women need to be listened to. You know, many of us, like for instance, if you're counting the kicks and you feel that the baby is not moving the way it always did, then insist on being heard, because this is your pregnancy, your baby, and you know best. So advocacy, you know, we as women sometimes tend not to be good advocates for ourselves, but this is an excellent time for you to be an advocate and to insist on being heard. with your provider, have that discussion. And if the reasons for that induction are for your health and your baby's health, and you can be convinced that that is the best way to go, then go that way. But advocate for yourself and make sure you ask the questions.